we're happy that you're here because we have an important topic to cover.
We are going to talk about pregnant women and children and why it's so important that they get to the chiropractor and get checked.
Dr. Zane has some diagrams that will help with the anatomy and understanding in our little demonstration here today.
Yeah, if you can imagine that the uterus is like a hot air balloon. A hot air balloon has ropes that hold it down, and the uterus in the mother, as the baby grows, it has ligaments that also tether it to the mom. One of them being the round ligament. You have two of those, one on each side, and then the broad ligaments, which are in the back that hook to the pelvis.
So how does these ligaments relate to pregnancy and chiropractic?
Well, if these ligaments get tight in any way, it can start to pull on the uterus, just like it might pull on a hot air balloon if one of the ropes on one side is tighter than the other. And that can start to restrict to where a baby wants to go and start to restrict optimal positioning of the baby. So in chiropractic, when you have misalignments on those in the pelvis and in the spine that start to pull on those ligaments, it can create that effect. So instead of having lots of room and lots of expansion of the uterus, it starts to look like a hot air balloon that's kind of twisted and getting blown in the wind.
So with that, we have a specialized technique we use here at Evanston Chiropractic that's used all over the nation by chiropractors and have helped pregnant women with their pelvic alignment and also help let that baby sit in there comfortably.
So in the ideal situation, all these ligaments and the pelvis will be all aligned and just healthy. And statistics have shown in research that women who are under regular chiropractic care during their pregnancy, they have almost 30% less labor time. That's almost 5 to 6 hours less during your first birth than the average mother.
That's pretty significant, isn't it?
Yeah.
Also though, even in those ideal situations, it's still a pretty intense process. So baby can undergo a little trauma during that process.
Yeah, that's why we recommend to always get your baby checked after he or she is born. And there's a good way for you to be able to recognize if your baby really needs to come see a chiropractor.
We call that JET syndrome.
Yes, JET syndrome. What does the J stand for?
J is jaw, so
you can see their jaw deviate to a side. That's especially easy to recognize when they yawn.
E, eye.
One eye is larger than the other. They're asymmetrical, and it almost looks like your baby's kind of winking a little bit at times.
And T, that's for tilt, turn, or twist.
And that is when you can see your baby's neck or spine just twisted to one side. A lot of times they call it torticollis and stuff like that.
So those things are important because they're going to affect the baby's nervous system and development.
So come get your babies checked.
That's a great idea.
And if you are a pregnant mom, we would love to see you.
Thank you.